Hey there, 6 o'clock, and so we'll get started. So it looks like we've got a few people here that's joined in. So anybody that's here, or would you type in something on the chat? Let's make sure that everything's working. Just let me know you're here and that you can hear me and see me okay. Anybody care to do that for me? Hi, Glenda. Thank you. So are you everything okay? Okay. Anybody else want to sign in? Glenda's here. I'll know who we're talking to. Rhonda's here. Hi, Rhonda. Well, maybe we'll get some other people to sign in. Okay. Well, like you probably know, what we're going to do, we're going to go over that exercise that I posted a couple of weeks ago, and then kind of tell you why we do it and what the benefits are, and how it's something that can really help you. Hey, Ann, how are you? Thanks for joining. I think this is your first time, isn't it? Good, good. Usually we have 10 or 11 on what's going on, but anyway, so I appreciate everybody joining in. So hopefully you'll learn something and we can keep this as a reference. And kind of let me tell you kind of how it's not obvious. I can't teach you all of Chinese medicine in something like this. I mean, Chinese medicine I've been doing Chinese medicine now for 19 years and I still don't know it all. So it's something that and what have you, but what I can do is I can teach you enough about it that it can benefit you with your pet's health. There's no doubt about it. And what I can teach you can certainly be an adjunct to any problem that your pet has. And so just from this right here, you can learn enough that I promise you that it will benefit your pet. So keep this reference handy, and again, take notes, whatever you want to do, and keep it because it will help. I promise you. I'll give you a good example. When I first went to school to learn Chinese medicine and acupuncture, I mean, I didn't know that much. You know, I was in the learning process. I had not treated many cases and what have you. And I remember I had a client, it's actually a couple that had two young dogs. They were boxers and they were siblings. And if I recall, again, this was many years ago. And if I recall that they were, I think, around a year and a half to 2 years old. And one of the siblings was just one of these boxers was just healthy as could be. And the other boxer just had all kinds of health problems. And that had been ongoing for a long, long time. And this was, like I said, a dog that wasn't probably 2 years old. So, hey, Deborah. And so anyway, this is and I had been working on this dog for a long time, medicine too. And I had been working on this dog for a long time. And I don't like to pat myself on the back, but I consider myself a really good conventional veterinarian. I most of the time I could fix things, and most of the time I could really, really help pets out. And so I worked really hard at this one dog had so many problems. I mean, it had skin problems. It had a list of many, many ongoing problems. This dog was a white boxer. Its skin was just hyperemic. It was extremely dark pink. It had skin problems all the time. It had ear problems all the time. It had seizures. It had gastrointestinal problems all the time. You could put your hand about 3 inches from this dog's skin and you could feel the heat coming off of this dog. And it was just sick all the time. It just had a multiple list of ongoing problems. And I used conventional medicine on this dog and treated. And this dog had very little, if any, improvement whatsoever. And so it was really frustrating. And so one day I decided, why don't I just jump ship with this dog? And literally, I remember exactly what I did. It was the first time that I ever did this. And what I did was I took a piece of paper and I wrote down all the symptoms that this dog had. And that's just kind of what we did in this exercise. And I wrote down everything specifically what this dog was doing. It was itching, had red skin. I mean, so and that's all I did. I just listed the symptoms this dog had, the heat, everything. And so I had a list of probably 12 different things down there, and no interpretation whatsoever, just a list of the symptoms. Okay. And then what I did was I took that list of symptoms just like we did, and I said, what acupuncture points can I use for that symptom? Okay. And all I did was same thing we did with this, was I had a list of symptoms, and I made by each symptom the points that I knew that would benefit that symptom. That was it. That's all I did. I didn't even know Chinese medicine. I mean, I didn't know Chinese herbs. I had not gone back to school to learn that yet. So I had no Chinese herbal, and I didn't even get into the depth of it. I didn't deal with deep imbalances and stuff like that. That's all I did. Took a list of those things, and the points that I knew could treat those symptoms, and that's it. Just the symptoms. Okay. And then I called Kevin. Kevin was the guy's name, and I said, "Bring your dog by. I wanted to use Chinese medicine on it, and I just want to see how if this will help." And he was a really good guy, and he brought his dog by, and I treated every one of the points that I had listed on this piece of paper, and I didn't have a clue what was going to happen. So I treated him and sent him home, and Kevin called me back in 48 hours. And he said, "I've got a new dog." He said, I can't believe it. He said, I've got to bring her and let you see her. And so he brought her by, and her skin was completely normal. I mean, this dog would fasciculate, and it was gone. This was literally a new dog. And we were both in shock. I mean, it was like, oh my God, this worked. And so we were just flabbergasted. And so he said, I remember him saying, "Well, what do we do?" And I said, "Well, let's treat her once a week for a while and see how she does." And he said, "Okay, great." And so he brought her back in a week. She was clinically normal. And so I treated the same points again. I didn't dig any deeper. I didn't do anything. I didn't change food. I didn't put anything else. I just treated the points again. And so she did fine. No symptoms came back. So he brought her in once a week for about 3 weeks, and she was clinically normal. None of these symptoms, all those symptoms were gone, every one of them. And he said, "Well, how long do you think we need to do this?" And generally with chronic situations, we treat them, just a generalization, once a week for 8 weeks. Okay. So anyway, I said, well, let's just do it once a week for 8 weeks and see what happens. So anyway, we were, like I said, about the 3rd or 4th week, and something came up in his appointment, and he had to skip. And so he missed that appointment. And within about, I can't remember, several days after he missed the appointment, the symptoms started coming back again. Okay. And so I remember him called me and said, "Oh, they're coming back. She's doing this and she's doing that." And I said, "Oh, okay." I said, "Well, let's get her in." And so got her back in, treated her again. Symptoms went away. Treated her for 8 weeks. Symptoms were gone. Discontinued the treatment, and she never had the problems again, ever. We discontinued, and she stayed in balance. And again, I never dug any deeper. I never knew anything more than treating the symptoms that we did. And when I first started and I first got into this, I did that with many patients. And I'm talking about everything from neurological dysfunctions and everything. All I did was just converted the symptoms that I was seeing into points, and I activated those points, and that was it. And we had tremendous results. And not going any deeper than that, not, you know what I mean, not a holistic approach, just simply treating the symptoms by activating the acupuncture points. So don't think that this is not a very powerful opportunity for you to help your pets, because it can. Okay. So what I'm gonna do, and you've seen this, I've listed some general symptoms, and there's a lot more symptoms, but these are the ones that popped into my mind that I thought would help, because some of them are acute symptoms, and some of them can deal with some chronic situations. So just remember that if it's something that's been chronic and been going on for a long, long time, then the more than likely there's going to be deeper levels to it. But it doesn't make any difference, because the way it works, and you've heard me talk about this before, when you're working from a Chinese medicine perspective, with chronic situations, then or intermittent situations, and it might be something like allergies, it might be something like gastrointestinal disease, it might be cancer, it might be any of those things that are long-term pain. So the point is, when we start treating from a Chinese medicine perspective, then it's like peeling an onion. Okay, so there's layers there, and the longer that it's been going on, then the potential for more layers. But it doesn't make any difference how many layers there are. We work from the outside in, and the way we work from the outside in is dealing with those clinical symptoms that we're seeing, because they're going to be the best scenario at reflecting the outer layer that we need to address first. Now, if we treat the outer layer and not even knowing what's going on, just treating the symptoms, then what'll happen is those symptoms will improve and get better. And then sometimes, as you get rid of that first layer, at that first outer layer, and get to a deeper layer, then you may have new symptoms show up. And so all it means is that you change your point formula. Okay, so maybe instead of having diarrhea, maybe you have another symptom, and so it shows up. And then what you do is, that new symptom that shows up, you just find the points that are going to benefit that and treat those. It's just that simple. It's that simple. And you can, again, you might not, resolve cancer or anything, but I promise you, it will help your pet. So learn, whether you learn it or whether you just keep it handy, just remember, it is going to benefit your pet. I don't care if it's on 100 different supplements. I don't care if it's on Chinese meds. I don't care if it's on conventional medications or whatever. This is going to be a very powerful adjunct for you helping your pets as far as a health perspective, okay? And believe me, like I said, it's not a holistic approach. It's strictly Chinese medicine, and it will benefit in ways that no other modality will, okay? It's that simple. So let's get started. So if you have any questions, then just type them in, and I'll answer them for you. But remember, these aren't all the symptoms, and it's not getting into a lot of depth. Okay, so what I want you to understand is what we look at the symptoms, and then, hey Jonah, welcome. We look at the symptoms, we find the points, and we identify what the Chinese, how they define that symptom. Okay, because what happens is, let's say that you want to dig deeper, then you don't want to, then what you want to do is you want to find the Chinese interpretation and then say, what does that mean? Okay, what does it mean? So essentially, I'm going to give you the symptoms, the points, and then define that. What does vomiting mean in Chinese medicine? What does diarrhea mean in Chinese medicine? Because they're not going to say diarrhea, they're going to say this, okay, or they're going to say that, okay, and then that's your reference point if you want to dig deeper. So how does this occur? How does, like vomiting in Chinese medicine, they call it rebellious stomach qi. Okay, they don't say your pet's vomiting or this person's vomiting. This individual has a rebellious stomach qi. And so if you're going to get to the source of it, the potentials that are causing that, then you've got to be aware of what that is. It's just like the Chinese herbs. If you're using Chinese herbs, then they're the Chinese herbal names, Xiaoyawan and stuff. So you have to be able to convert this, and that's what it's all about. It's about conversion. All right. So that's what we want to do. So let's look at these a bit, and we'll talk about them. And then if you have any questions, just type them in. If there's other things later on, other symptoms that I have not listed, that you want more, then just put them on the Facebook page, and I'll tell you the ones that I use, okay, and have used over the last 19 years. Okay. Now, the other thing, and I mentioned this on the Facebook site, was that these points are for these patients are not all the points. Okay. And the reason I'm saying that is because the let's say you had a chronic disease that's going on, then and let's say that you have a pet that's got inflammatory bowel disease and it's had it for 8 years. Okay. Well, then what happens is, because you have these layers of onions, just like these layers that have been going on, then the point is that there might be things, let's say that there's some liver imbalance. So in that scenario, then there might be liver points that are going to benefit this as a whole situation. But again, you've got to get down to that layer. So I don't, even though let's say you looked up all the points that might have to do with diarrhea, then you probably find some points that I haven't listed. And that's why. It's because at some layer, there might be an association with causing the diarrhea. Let's say that you went out, let's say you as a person went out and you ate a meal, and let's say that you got sick from it. Let's say you picked up some salmonella or something from it, okay, and that caused you to have diarrhea. From a Chinese medicine perspective, that would be a different definition, because you've had a pathogen that's invaded you versus a spleen imbalance that created that diarrhea. Okay, but we're not going to be dealing with those scenarios. We're going to be dealing with, again, the basics. Okay, all right. So let's start, and we'll kind of run through and again, a couple of these don't have Chinese definitions, but I put them in there just so that you could use them. Because again, remember, Chinese medicine's been around for 3,000 or 4,000 years, and back there when they developed this energetic modality, they weren't really good, or I shouldn't say really good. They didn't define things the way that we define things, and so when we talk about things like autoimmune regulation and what have you, they didn't use those terms and stuff like that. So, but anyway, so let's get started. The first one that I listed was vomiting. And that's a really, really common problem that we see with pets. And so many times, and I'm just going to use this as an excuse, and I won't draw this out with all these, but there are a lot of times that let's say you come home from work and you find out that your pet's vomited 3 or 4 times on the floor. Okay, and you're looking around, you're going, oh, and so this is a good perspective, and I tell a lot of my clients like this. So if you find a bunch of vomit on the floor, and you look at your pet and you go over and spend some time with it, and a lot of times these pets, they might not act sick. They're very happy to see you. They just vomited, or maybe you heard them vomit once or twice, and that's it, and they're acting perfectly normal. Well, so you got this dilemma. Let's say you got home and you found 5 areas that your pet's vomited, and you look and you say, oh my gosh, should I run to the clinic? And maybe it's 30 minutes till the clinic closes. Maybe clinic is just about to close and you're going to end up at the emergency clinic. So you sit there and say, should I go or should I not? And then what I would have you do is look at the pet and see, is the pet really that sick? Because if it's really sick, then of course you want to go. You don't want to wait, and you can tell that it's your pet. But a lot of times when you have these simple gastroenteritis, they're not sick. They just have an upset stomach and they vomit a few times and they're acting perfectly normal. So in those scenarios, that's when you want to say, okay, this is what we want to do. We've got some vomiting here, and she's not acting that sick. So I don't think I need to go, but I'd like to do something. So obviously then first thing we're going to do is we're not going to feed them anything, because we're going to rest the stomach. So then we're going to get out our activator and we're going to activate some points, because we're just treating the symptoms and we're not dealing with what caused the problem. Because if it were something like a pancreatitis, then the dog or the cat's going to be really sick and they're not going to be responding to you, and you're going to know, and if it was an outdoor pet and it got into some toxin out there and that's why it's vomiting, then obviously it's not going to be a pet that's going to be running around acting like it feels fine. So anyway, so that's what I'm talking about. So you get the vomiting scenario and say, okay, so what points do I want to activate that gives the best opportunity to slow that vomiting down. And so the points that I picked are the ones that I use and that we typically use as Chinese medicine practitioners. Pericardium 6 is an anti-nausea point. And remember, the points that we're talking about can all be found on those charts. Now, there is access to the dog and cat acupuncture charts on the Facebook page. If that, again, it's hard to get all the points and all the meridians on one chart. And so if you're having trouble finding a point, then just get on Google and Google and just search for acupuncture charts for dogs and cats. And you may find one that'll focus in on a little bit better. Now, I don't know. I know several people have gotten the book by Cheryl Schwartz called Four Paws, Five Directions. I think several people have it. So that's a pretty nice little reference book that shows the meridians and the points, the popular points, especially the leg points and what have you. So you might consider that at some time. It's not expensive. It's a softback book. It's a book that I used to have a couple of copies and I gave them to clients, and they were going to bring them back, but they never did. But it's a pretty nice reference for locating points and some general understanding about Chinese medicine. But anyway, the points are not that hard to find. And remember, if you're using something to activate the point, like essential oils for dogs, arnica for cats, then if there's a point that you're having trouble finding, and then just get in the general area and use a bigger spot. Instead of a spot being the size of a dime, put a spot the size of a 50-cent piece. Just all you're trying to do is get close to the point so that you can activate that point. Okay, so the 3 points that I like for vomiting: pericardium 6, that's number 1 point. It is an anti-vomiting point. So it affects the vomiting center in the brain. It's an anti-nausea point. And so that is a really powerful point for vomiting. So pericardium 6 is always my first go-to point. And remember the same thing for you. And this is important too. It's not for just pets, it's for you too. So if you've got some nausea, let me give you a great example. I remember one time on an airplane, and my family was on the airplane, and we got in some really bad turbulence, and we were bouncing around, and the people were grabbing the whoopee bags and everything, and everyone was nauseated, getting ready to vomit. And I remember looking over, and everybody in my family, including myself, was putting acupressure at pericardium 6 to knock. I mean, even my 2 daughters were activating pericardium 6 to knock that nausea out. And so these are good points for you to know as well. And so pericardium 6 is anytime you get nausea, use pericardium 6 because it's going to help you. Okay, Deborah says, Dr. Thomas, if you happen to have that pretend cat model, would you please show us where we can find stomach 36? Are you talking about the chart, Deborah, or what? Let me tell you how to find stomach 36. Okay, stomach 36 is a really important point, and it's a point that you probably should locate. Okay, it's on the outside of the leg, all right, and it's below the knee, all right. So it's the 2 bones that are associated with the leg, the hind leg in the pet, the tibia and the fibula. Okay, so it's on the outside surface, what we call the lateral surface. When you originally taught us, you had a fake dog model. Okay, I don't have it with me. I'm sorry, I don't. But let me tell you how to find it. Okay, when you feel your pet's back leg, okay, then let's say this is the back leg. Okay, just feel it on yourself. Okay, so when you put your hand on your leg below the knee, okay, find the kneecap and then put your hand flat and run it down from the kneecap down your leg, and you can feel that bone. That bone's exposed. That's your tibia. Okay, so that's the anterior surface of your leg. Okay, And so you're going down that ridge of bone right there. Okay. So you can just put your fingers like that, and you can, from the knee down, just feel that bone. And when you feel that bone, and you move towards your ankle with your fingers, you'll feel right after you get past the knee on the human. Now you're going to go about this far. You'll feel that ridge go along this, and you'll go for about 4 inches, and then you'll feel that drop. It'll drop down. You'll feel a little indentation right there. So what you have is you have a ridge. You have a ridge there, and so what it's like is, okay, here's the bone. Here's the kneecap right here. And here's the bone that goes down, and this is called the tibial crest. It goes down like this, and then it drops off, and then the bone continues to go straight like this. Okay, so you're going down, and then you feel the bone drop. So it's like you're coming off a hill. You feel it drop down. Well, right where it drops down, that tibial crest drops down, right there is your location point. So you, same thing, and a cat has it, a dog has it. Obviously depends on the length, how big the pet is, but you can just rub your finger right along that bone, and you'll feel that little drop, and that's where the tibial crest is, and that's your point locator. Okay, so you find that point, and you know you've gone far enough down, and then what you do is you move one finger over what we call laterally to the outside, because you're on the anterior, the front ridge of that bone. And what you want to do on a small dog or a cat, then you want to find that little dip. That's your point to how far you've gone down, and then you go over one finger. So you just go over about that 3/4 of an inch, and that's where that's where stomach 36 is. And if you right there on your leg, if you find that point and you go over, now in the human, you're going to go over about an inch, inch and a half. And if you put a little pressure down there, you can feel a division between the heads of the muscle. You'll feel a little bitty indentation in between the bellies. Okay. And if you put a little pressure right there with your finger, it's going to sting. You're going to get a little sting, like an electrical charge, and that's stomach 36. And so find it. That's how I remember. That's how they taught us. Find it on yourself, and then you can just extrapolate finding it on the pet. So remember, find that it's below the knee. Find that tibial crest, run it down, and then feel it drop off, and then move to the outside. If it's a small pet, then go about about the width of your finger, a 1/2 inch, 3/4 of an inch, and you can feel it right there. If it's a big dog, then I would probably go 2 fingers, and then go over there. And generally, if you put a little pressure right there, most of the time they're going to react, because they'll feel that little stinging sensation, because when you put pressure on that point, it's going to give a little bit of an electrical charge. So remember, all tibial crest, that little notch right there, come across, and then put your activator on there, make a spot, about the size of a quarter, and chances are you're gonna hit it. All right, it's not that hard. And once you find it, you can go to it immediately. It just takes practice in all these points. Okay, so look it up, practice, find it on yourself, find it on your pet. I teach people, when I used to have my office open, I would take a black felt tip marker, and I would put that dot right there, and so they would find it, and they would go home and they would practice. And it doesn't take much to learn those points, but stomach 36 can be a little difficult to find. But so find that, and because it's a really important point. Okay, so pericardium 6, pretty easy point to find. It's on the front leg, on the medial surface, the inside surface. Okay, and so it's pretty easy to find. So pericardium 6, stomach 36, we just talked about that. Why is it a good point for vomiting? Because stomach 36 is one of the 2 master points for the abdomen. Okay, so it's gonna be a major point, master point for the gastrointestinal system. All right, so any gastrointestinal problem that we got, whether it's vomiting or diarrhea, then we're going to use stomach 36, because that's one of the master points. All right, so pericardium 6, stomach 36, and bladder 21. Now, bladder 21 is the blood. Okay, and remember how I taught you to find these bladder points to go down and find the last rib. Okay, and so you find the last rib and the surface. So you just run along the side of your pet's rib cage, and you get to the last rib, and then you go, and then what you do is you find the very border, the farthest border from the head, and you come straight up to the top, the dorsal spine, and that's your point of location. So you find that dorsal spine, that's that point that's sticking up on the spine. So you're coming up there, you find that, and then again, you move over one finger's length. The bladder meridian is bilateral, it's one on each side of the spine. And so what you do is you come up, last rib, come up to the dorsal tip, and then come over a half an inch to 3/4 of an inch, decide depending on the size of the pet. That's bladder 23. So that's the point when you're looking for your bladder points. You want to find bladder 23 as your marker, and then you start counting. Okay, so you find bladder 23, and bladder 23 point is your bladder association point for the kidney. So that's a good point to know, especially if you've got a cat with kidney disease or a dog with kidney problems. But anyway, you find bladder 23, and then you move forward, and each notch you'll feel the notch because there's a rib there. And as you move towards the head, you start counting the numbers down. So you go from 23 to 22 to 21. There's your bladder 21 point. It's bilateral. So you put a little bit of activator on both sides of the spine, and you've activated the association point for the stomach. Okay, because remember, each one of those is an association point. Bladder 23 is for the kidney. Bladder 22 is for triple heater. Bladder 21 is the stomach. Bladder 20 is the spleen. 19 is gallbladder. 18 is the liver. 17 is for blood, et cetera, et cetera. So and then if you have like large intestine, small intestine, and what have you, and then let's say you want to find bladder 28 because you've got a pet with a bladder infection or urinary incontinence or something, and so you're gonna find bladder 28 to treat it. So you find bladder 23, but instead of moving towards the head, you start moving back towards the tail. So your next point's going to be 24, 25, 26, 27, 28, and then that's how you find it. So find bladder 23 first, and then move both directions, depending on which one you're trying to find. So for vomiting, pericardium 6, stomach 36, bladder 21. Now remember, in Chinese medicine, they call that rebellious stomach qi. And so that's what vomiting is in Chinese medicine. And it's always going to be associated, again, with a gastrointestinal problem, which is the earth element, which the yin organ is the spleen. And I might call it the spleen pancreas, because the pancreas throws in the function of the spleen from Chinese medicine, and that's providing or converting nutrition into energy. So we've got the spleen pancreas is our yin component, and the stomach is our yang component. So we've always got those. So whenever we have vomiting, we're always going to have the earth element. So we're going to be looking at stomach and points and spleen points too. Okay. So as underlying causes. So if we've got stomach, we're going to have a stomach imbalance and probably a spleen imbalance as well. Now we may have liver associated with it too, but we're not going to get too deep on this right now. It's going to make it too confusing. So anyway, so there can be one other thing that we see in a lot of older patients that sometimes is some food stagnation, and that's an energy movement problem. And again, we're trying to move stuff through there. So we're focusing on moving energy into the stomach. So, but anyway, so those are the points that I'd like you to remember. So anytime you have a vomiting pet, work on those points. So the next is diarrhea. And that is when you have a pet that has diarrhea, then that's always 100% spleen imbalance. Okay. And remember, spleen is the yin organ of the earth element. So you're always going to be dealing with spleen. Something going on with spleen imbalance. So we're always going to be focused on that when there's diarrhea. Okay. So the points that we want to work with are GV1. GV1, I don't know if it's the point right when it's on you lift the tail up and you have the anus right where the back part of the tail connects, right? So it's right above the anus, right where the tail is, and that's GB1, and real easy to find. And that is a really good point for acute onset of diarrhea. So if you have you come home and your pets had diarrhea all over the house, and so that's going to be your number one point with acute diarrheas. All right, so don't forget that one. GB1's really important with that. Stomach 36, same thing, another really important point for diarrhea. And it really, really helps. It really helps. I remember one time when I first started doing acupuncture, I remember I went to, I was talking to somebody that did human acupuncture, and we were talking about how stomach 36 helped with diarrhea. And I told her, I said, yeah, I keep a box of needles at the toilet, for the family that has diarrhea. And she said, well, I keep 2 boxes next to my toilet. And the point is, it's a very, very powerful point for diarrhea, abdominal cramps, all that pain that's associated with diarrhea and stuff like that. Stomach 36, if you activate that point, it's going to do miracle work for you, miracle work. And so find that point. I remember my kids when they were little bitty kids, and they would eat something and it disagreed with them. Maybe they'd eat some candy and it'd give them diarrhea. They would come up and say, Dad, would you put a needle in? And so that the diarrhea would stop. So again, back then I was just using needles, but I kind of activated the point using some essential oils or stuff. But the point is, it's really, really powerful point for diarrhea. And really, when you get those gut contractions and all that pain and stuff like that, really helps. So GB1, stomach 36, spleen 6 is really good, especially with chronic diarrheas, inflammatory bowel disease. That's another master point for the upper abdomen. So spleen 6 is another important point. And then bladder 20. Bladder 20 is the bladder association point for the spleen. Okay, so remember, I told you how to find bladder 23, and then go up to bladder 20, and remember there's 2 points. So remember, whenever there's 2 points, you want to activate both of them. So if you're doing stomach 36 on the right leg, then do stomach 36 on the left leg as well. It's bilateral. So I know some veterinarians that only do 1, but I've always done, if there's 2 points, I use them. I do 2. Okay. So remember, diarrhea is always going to be a spleen imbalance, and so you're going to be dealing with that. Okay, so the next one is anorexia. Anorexia, they really don't categorize anorexia as a problem within itself. It's a symptom, again, that's generally associated, if it's persistent, it's associated with a spleen imbalance. So if you were to list symptoms associated with spleen imbalance, then lack of appetite or anorexia would be under that list of symptoms. Okay, so whenever you're dealing with anorexia, you've got a spleen imbalance going on as well. So we're going to, if it's persistent, then we're going to have to dig deep and look and see what's causing that spleen imbalance to get it to resolve. But for treating it symptomatically, then stomach 36. I mean, look, the first 3 that we talked about, stomach 36. So stomach 36, in my opinion, is probably the strongest appetite stimulation point. I've seen it work so many times on so many animals. And I remember years ago when I was working in Coeur d'Alene, we had a mixed practice, and we had a large animal veterinarian. We had a barn outside, and we had a large animal veterinarian that was hired to do the large animals. And he came in one day and he said, I've got this goat out in the hospital, and this goat hasn't eaten a bite in 3 days, and I'm afraid it's going to die. I've tried everything, I've given everything that I can, and I can't get it to eat. And he said, is there anything you could do for me? So I said, sure. And so what I did was I took a 1/4 cc of vitamin B12. Okay, so I got it in a syringe, and a 1/4 cc, and I went out and had him hold the goat, and I found stomach 36 on that goat, and I injected that B12 into that stomach 36 point. Now, why did I do that instead of using a needle? I did that for 2 reasons. One is I wanted to activate the point, But secondly, using an injectant of B12, we call that aqua therapy. Aqua therapy. We're injecting something into the point site. And what that does is that creates a, in other words, if I put a needle in there, then most of the time we leave a needle in there somewhere between 10 and 15 minutes, and then we pull it out. But if you inject something in there, then it stays in there for a longer period of time. So it gives you prolonged activation. And the other thing, B12 is an appetite stimulant as well. So then it's like me using essential oils to help something. Well, I was using B12 because B12 is an appetite stimulant. And so I injected it into an appetite stimulating point. So I'm getting two birds with one stone, you see. So I injected that point, and later on that afternoon, he came and told me that the goat was eating and was eating really well. And so it works really, really well. So find that point. It's really important that you find it and that you use it. Okay. So anorexia is a spleen imbalance. The other point is called Shangen. Shangen is that point on the top on the nose, and it's right on the dorsal surface of the nose, right here. And so you can find it because the hair point of the nose comes down, and then you lose the hair, and then you have what's called the dorsum nasale, which is the leathery part of the nose that doesn't have it, the hairless part of the nose. And so you're coming down the nose on the hairline, and then right where the hair ends, that's Shangen. And so you just put your activator right there. And that's another powerful point to stimulate appetite. I generally, when I used to use needles to activate that point, I would use a little bit of what's called a Korean hand needle. And I would put a needle right there in that point in the office. And it worked really well. The problem was that the pets would flick their tongues up there and knock it out. So I had to keep putting it back in. But a really powerful point too. Okay. So again, if you've got a pet that's been sick and that's not been eating, then do all three of those points. Okay. And I would do them once a day. All right. Okay. So the next one is itching. So again, that's a clinical symptom. It's not a disease, so it's not going to have a classification, but itching in Chinese medicine is considered wind. Wind is the cause of itching. Okay, so itching can this wind that creates the symptom we call itching can come from external wind, and generally that means that external invasion that's creating this wind, and that in the most common thing that we see in pets is seasonal allergens. That's a good example. So if you have a pet that's allergic to the seasonal allergens out there, let's say you've got a dog and that's allergic to oak or some tree or some grass. So when those pollen counts are high, then what happens, those pollens are coming into the system and triggering a reaction. And the Chinese call that external wind. And so when you have external wind from that, then we're dealing with points that are going to be relieving the itching. But then again, when we dig deeper, then we say, okay, well, I'm going to treat these points. And that's all you really need to do is treat those points to get you some symptomatic relief. Now, if you want to dig deeper and you sit there and say, I know that this is caused by allergy, then we know that allergies are about the immune system. And so we can also activate some immunomodulation points too to help with that. But I don't want to get too deep in that because right now we're talking about symptoms and how that those things are springing up. Okay, so external wind. So anything that's moving in from the outside that's triggering itching, we call that external wind. But the points are the same. Okay, now internal wind that causes itching, that's going to be usually caused by the liver. The liver is responsible for internal wind, and so that might be a scenario where you have like the skin. So if we have allergies, then environmental allergies that are being breathed in, that's external wind. So let's say we have a food allergy, and what's happened, that's coming in from the inside to the outside. And so what we may have is we may have a dermatitis, we might have skin infection, we might have redness, we might have dampness, and the itchy comes from the heat. and the wind. So you get a combination. So anyway, the wind is what's causing the itching, and we have points that we can address that wind. Okay, and so the points that I like: large intestine 11, very very strong point. I like this. That's my go-to point, especially when it's dealing with allergies, because not only is it a good point for itching, but it's also a really good point for the immune system. Okay, so that's my number one go-to. Gallbladder 20. Gallbladder 20 is at the back of the neck. If you put your finger and your thumb back to the back of the neck, you can feel that little indentation on both sides of your cervical spine. Feel that little indentation right below your skull. That's gallbladder 20. If you put a little pressure there, you can probably feel a little stinging sensation right there. Okay, that's gallbladder 20. Really good for itching. That's another good point. That's good for sinuses too. All right, I'm just throwing that in. If you have a sinus infection or you've got a cold and you've got congestion, then get in the shower, put on your massage on your shower, and let it pulsate on that gallbladder 20 at the back, and your sinuses will clear up. Okay, but that's a really good point for relieving wind too. So large intestine 11, gallbladder 20, bladder 12. Remember how to find the bladder points. Bladder 12, again, it is really good for itching. It's also good for coughing. It's also good for fever, but really strong point for itching. Spleen 10. Spleen 10 is on the inside of the knee, inside of the back leg, just above the knee. Real easy to find. And that I use a lot with dermatitis, especially food allergies and stuff like that, because usually we've got the gastrointestinal system that's associated with that as well. So if you've got more than itching, if you've got some skin that's going along, problems going on, like say you've got a itching associated with ear and maybe the ear is infected, or you've got a discharge in there, whatever, you're swelling, then spleen 10 is really going to help you as well, because it's not only going to deal with itching, but it's going to be dealing with some other things, probably usually like again, damp heat as well. Okay, so remember, so itching is wind, and those are the points associated with that. So the next one is anxiety. All right, anxiety in Chinese medicine, that's defined as a Shen imbalance. Okay, and Shen is, that's S-H-E-N. Shen means peace, internal peace. Okay, when you have peace of mind, then your Shen is imbalanced. Okay, and so whenever you have anxiety, then obviously the Shen is out of balance, and they call that Shen imbalance. So anxiety defined as Shen imbalance. Shen is housed in the heart. Okay, so when your heart is in balance, then your Shen is in balance. Okay, so if you have you have anxiety, if your pet has anxiety, then you've got a heart Shen imbalance. Okay, so that's the underlying definition of anxiety in Chinese medicine. So there's points that are really good that deal with anxiety, and again, very very powerful in pets and in people too. So if you're getting stressed, then use these points. Okay. Pericardium 6. Remember we talked about that with the vomiting and nausea. Okay, it's a really good calming point. Find it in yourself. Find out, and if you're stressed, you can be waiting to go in to see your accountant or whatever. You're on the airplane and you're stressed. Just find that point, put a little digital pressure on it for a couple of minutes, and that's going to make all the difference in the world. It's gonna relieve your anxiety. I've helped people before in situations. I remember one time I was at the park, one of the local parks. It was in the summertime, and I think we were having a little picnic, and there was a table right down from us, and there was 3 or 4 little high school kids, or junior high school kids with their mom, and they were having a little picnic at their picnic table, and one of the girls was stung by a bee. It had gotten inside her glasses and stung her right below the eye, and she was freaking out. I mean, she was screaming and screaming and screaming, and they were trying to get her to calm down. And I walked over and introduced myself, and I said, "Hey, I'm Dr. Thomas. I think I can help your daughter here. And they're like, yes, yes, do anything you want to. All I did was I found pericardium 6 and I put a little pressure with my thumb on there for a couple of minutes, and you could just see her just melt into the moment. And she just started relaxing and calmed down, and she just completely regained composure. So a lot of times you can help people out when stuff's going on like that. So find that point on yourself, find that point on your pet, and use it. It's a very powerful point. So pericardium 6, heart 7. Heart 7 it's real easy to find. You'll be able to find it on the chart. It's on the front leg. We have a different anatomy than our pets do. Right, it's right here. So it's real easy to find. It's in the indention, right next to this tendon. You'll be able to find it. That's heart 7. That's another nice anti-anxiety point. It's a good point for heart problems and what have you. So pericardium 6 and heart 7 are your two most powerful anti-anxiety points. So learn to find them for yourself and your pet. Okay, GV20 is often used. GV20 is the point right at the top of the head. Like in humans, they call that byway. So that's GV20 right there, the top of your head. Bladder 14 is the association point of the heart. Okay, so that's why they use that as well. But remember, pericardium 6 and heart 7 are by far the most powerful. Okay, so that's Shin imbalance. It's always associated with a heart imbalance. Okay, most of the time, if I were to say most of the time, it's a heart yin imbalance. But again, you want to get that anxiety going. You want to, and that's both of those points are not only going to help with the anxiety, but they're going to help with the heart as well. Okay. All right, moving on. Fever, not really a term that we have defined. It's usually caused by a excess yang. Remember, yin is the cooling moisture component, and yang is the warming, drying component. And so usually when we have a fever, we've got way too much yang that's going on. And so we're generally focused on relieving that excess yang that's causing that fever. And you know all the reasons that you can have a fever. Usually it's a microbe invasion. So if we want to bring that fever down, then the points that we use are large intestine 4. Large intestine 4, it's a really powerful point. Again, it's right here in people. I'm sure you've seen it, but it's real easy to find in the dog, large intestine 4. You put a little finger pressure right there and it'll sting. And so that's a really good point for bringing the fever down. If you have a fever, you got a cold and you're feeling a fever, hit that point, put a little pressure, activate with some essential oils, what have you. And so that's going to, large intestine 11. Remember, I was telling you that's another good point for releasing, again, for itching, for wind, but it's also an immune modulator, point 2. And so large intestine 11. So you're doing large intestine 4 and large intestine 11, both of them on the front leg on the same meridian. So you want to activate both those points with a fever. And remember, both of them affect the immune system as well. So those are going to be really important points. Ergen is a point just inside right here. So you get to the apex of the ear and go on to the inside of the ear, and that's Ergen. So that point right there, you can just, if you got a fever, you can take that point, put a little pressure right there. That's going to drop your fever down. Again, activate it. Same thing with your pet, running a fever, then get a little bit of activator, putting it on just on the inside of that. So that's Ergen right there, just on the inside right there. Works really well. And then the last one, I hope, is GV14. I was hoping GV14 is another really powerful point that I use, again, to get the fever down, and also I use that for seizures as well. I'll tell you a story that I had. I'll give you an example with that. I might have told you this story before. Had a dog. This was when I was working at a big hospital. I was owner of a big hospital in Coeur d'Alene, and so we were doing both. I was doing both conventional and alternative medicine as well. And we had a boxer that was there he was an older boxer, to have some dental work done on it, and the technicians were having trouble getting a catheter in this dog to get it prepared, to get it ready to have the anesthetic. And I happened to walk by, and the dog was kind of wrestling with him, kind of fighting him, and they were kind of trying to hold him down and stuff like that. And I mentioned to him that, be careful. This is a boxer. It's brachycephalic, a short-nosed dog. And I said, if you stress them, sometimes they'll get what we call brachycephalic syndrome. They go into this cascade of event. And so I said, just, give him some time, relax, don't push it. And so I went on about my business. I had to go check on a patient in the back of the hospital. And so I came back a few minutes later, and this dog had collapsed and was on its side. And they had stressed that dog too much, and it went into this brachycephalic syndrome. And that is a true emergency. And so these dogs, what they do is they start turning blue on you. They start having trouble breathing. They go into shock. And so we got the catheter in. We were treating it conventionally, got a catheter in, started pushing fluids. We gave it the big slug of steroids because we're following the conventional approach. And so this dog wasn't responding. Temperature started rising. Temperature went from 101, kept climbing, 102, 103. Then it got up to about 106. And this is typical brachycephalic syndrome. We're doing everything that we can. The dog's having trouble breathing. Then all of a sudden the dogs start having seizures because of the high temperature. And so here's this dog having trouble breathing, 106 plus temperature and rising, and then is turning blue because it can't breathe, and then starts having seizures. This dog is trying to die. And so we need to get it on oxygen because it couldn't breathe. And so we needed 100% oxygen, but the oxygen cage that we had wasn't big enough for this big boxer. But we had a satellite clinic in a little town about 5 or 6 miles from where we were. And we had a new big oxygen cage over there. So I called my partner that was running the satellite clinic, and I told him that I was bringing this boxer over to get the large oxygen cage ready. So I put the dog in the car with the tech, and we drove over. Dog seizuring, I mean, just trying to die. And so my partner had the oxygen cage ready. And so we put him in there. The dogs didn't get any better, started having these status epilepticus seizures. And what happened was it just getting worse. And so we fill the tub with ice, and we started giving it an ice water bath to try to get the fever down. And we're holding this dog seizuring in this ice water bath, trying to get the fever down. It wouldn't come down. And Jim, my partner, was holding the front. I was holding the back. And he turned around and said, "Can't you do something with that Chinese medicine stuff? Because if not, this dog's going to die." And I hadn't been doing it that long. And so I went over and I got a hypodermic needle, and I put it in GB14. I just stuck a needle right into GB14. And immediately that dog's temperature started falling down, going down. The seizure stopped, temperature went back to normal, dog revived, color got good, and the dog returned to normal. So it literally, that one point, that's the only point that I did, GB14, and it turned that fever around and saved that dog's life. So it's a very powerful point. So these points really work and really do a good job. Okay, so GBT, that's the tip of the tail. So let's just say here's the tip of the tail, the very, very end of it. GBT is right there. So just put a little bit of activator on there. And so that works really well. Okay. So the next one, again, is coughing. Okay, so coughing, the definition of coughing in Chinese medicine is what we call rebellious lung qi. Okay, the qi is not moving in the right direction, it's coming back out. So they call it rebellious lung qi. So again, if you dig deeper, then you're going to have two types of patterns. You're going to have an excess pattern. Remember we talked about excess wind coming in? And so that would be a scenario that maybe you got a cold, and so you're coughing from this cold. Again, or maybe because people have more upper respiratory with allergies. And so if you're coughing, having then associated with that, then that's external wind that's causing the coughing. But most of the time in older patients and stuff that you have a chronic scenario, then that is an internal scenario. So you've got internal wind or internal deficiency patterns that's creating that's coming from it. And most of the time, that's a lung qi or a lung yin deficiency. So you're either dealing with excess, and those are usually going to be acute. And then again, if it's chronic, been going on for a long time, then you're going to be usually dealing with deficient patterns. Okay, so the primary points that we like to use for coughing, bladder 13, and that's the bladder association point for the lungs. And so we always want to do that. The lung meridian, 5, 7, and 9. Those are your points. Real easy to find. They're on the inside point, what we call the medial surface of the front leg. Okay, and so lung 5 is up by the elbow, the crease of the elbow. 7 and 9 are down by the wrist. Okay, joint, and really, lung 9 is probably all 5, 7, and 9 are really good for coughing. You can do all 3 of those. Lung 9 is really good for those very deficient patients. Let's say you've got an old dog that's got this chronic bronchitis. It's dealing with lung 9 is really, really good for very deficient patients. Okay, so bladder 13, lung 5, 7, and 9, and then CV22. CV meridian is an individual meridian that runs right down the middle, right down here. So CV22 is right up by the throat. That's a good point for cough. So I'm going to cough and then put a little pressure at CV22. So that's another good point. So, okay. So rebellious lung qi. The next one is immunoregulation or immune stimulating or activating points. And remember, these points are regulators, okay? A lot of herbs are immunostimulants, okay? Like echinacea stimulates the immune system. So if you have an infection and you want to help the immune system, then maybe you take echinacea to boost your immune system. Well, if you have an allergy scenario, which is a hyperimmune, overactive immune system, you sure don't want to use something that's going to boost the immune system even more because it's already too active. So you don't want to use so the thing that's not those types of herbs and make things worse. So what you do want to use is you want to use these acupuncture points because they're regulators. And so what that means, it means that if you have an overactive immune system and you activate that point, then it's going to bring it back into balance. So if you have an underactive immune system that's worn itself out, maybe from adrenal fatigue or persistent virus or persistent infection, and it needs a boost, that same point is going to bring that up and boost it. So it's bringing it back into balance. That's why we call them immunoregulators, okay? So you can use them on any scenario that you feel like the immune system needs some help. Stomach 36, that's that major, that wonderful point, very, very important. So stomach 36, large intestine 4, and large intestine 10. Those are all really, really powerful immunoregulation points. So anytime you have a pet that's sick, it's not, stress itself is going to affect the immune system. So, okay, so don't forget those points. Those are really important. So the next one is seizures. Okay, we all know what seizures are. Chinese medicine, seizures are caused by internal wind. Okay, and the internal wind, remember, is usually caused by the liver. So almost in all cases, then liver is involved with the symptoms of seizures. Okay, now the liver, there might be other factors involved, but there's the liver is what's going to be creating the seizures itself, the internal wind. Okay, and so the points that we use, and these are points I've been using for many years. They're very, very effective. GV20, the point on top of the head. I think I've told you the story before about putting a needle in there. Dog comes in status epilepticus, put a needle in the first time I ever did it. The seizure stopped, kept it in there for a while, took the needle out, seizure started again, put the needle back in, seizure stopped. So works really, really, really powerful. So GV20, gallbladder 20, remember I showed you those behind the top of the neck back there and that little fossa back there on both sides. So that's gallbladder 20. GV14, we just talked about that for releasing heat. Now how you find that, it's remember GV is right on the dorsal. It goes straight down the back from the top of the head all the way back, all the way to the tip of the tail. Remember where I said GVT was? Okay, well GV14 is right on the dorsal midline and it's right between the shoulder blades. Okay, if you find the shoulder blades right up on that, that's where GV14 is. And so that's really good for fever, really good for seizures. And so real easy point to find. The other one is on shin. That's what would they call a traditional point. That point is in It's close to GB20. If you move from GB20 towards the ear, then it's right here behind the ear. So just if you've got a seizuring pet, then go right behind the ear, about the level of the ear canal, and that's where it is right there. And it's a really powerful point for seizures. So GB20, gallbladder 20, GB14, and on Shen. As a matter of fact, what I like to do with seizuring pets is I like to put some activator in my hand and just pet them, just pet the top of their head. And so from the front to back, and so you activate GB20. There's another point right in front of GB20 called Da Fang Men. Then it's another anti-seizure point, and so you're activating. That's a calming point too. And so I use that for seizure pets. I use it for calming. Like when I would have maybe a dog that would come in that was agitated or nervous, what have you, and it was difficult for me to work with, and I would just put some and then rub it on the top of their head like that and give them about 5 minutes, and then the head starts bobbing and they start getting a little groggy. So it works really well. So that seizures, internal wind, and then remember, then what I would do is I would start investigating into what's causing, digging deeper. We get rid of the seizures, stop the seizures, and then start digging a little bit deeper and see what's causing that. Okay, but you think about it. If you had a pet that had seizures and they were treating it conventionally, so you take them in there, run a bunch of blood work, it all comes back normal. Maybe you plop down a grand and have a scan done of the brain, and they don't find anything, so they diagnose having epilepsy or what have you. And so what do? They put the pet on anti-seizure meds, phenobarbital, Keppra, things like that. And basically, those are anti-seizure meds. They're to control the seizure. They don't have anything to do with what's causing the problem. So remember, instead of having to use that, you can use points and get the same benefits. Even if you might not be addressing the specifics, but I promise you'll be moving more towards that by doing points than using drugs that have harsh side effects. And one of the problems I don't like about most of these drugs, these anti-seizure drugs, is that they stress the liver, and because the liver has to metabolize them. And so that's why when you have a pet that's on these anti-seizures, they have about every 6 months they check to make sure that it's not causing any damage, especially with like phenobarbital. They do phenobarbital levels because it'll stress the liver. Now remember, I told you that almost all seizures are due to liver imbalance. So if we're using a drug that stresses the liver even more, then in my opinion, that would be contraindicated in the long run. Okay. So GB20, gallbladder 20, GB14, and on Shen. Okay. The next one is shock, and shock is pretty much a cardiovascular collapse, so it's going to be associated with the heart vascular system. All right, and the point that we use is GB26, and that's that point right here, right there at the nose point, right there where the nose comes down, and right here, that point, you can feel that little indentation right there, and that's a shock point. And it's an excellent point. Learn that because you literally can save somebody's life knowing what that point is. I have a colleague of mine that drove up on an automobile accident, and it was a really bad one. And people, they had drugged these people out of this car wreck, and there was a lady laying on the sidewalk, and she was in shock and she was in bad shape. And this colleague of mine knew acupuncture, and she went over and did pressure on that GB26 point, and that revived that lady. It got her out of shock, and so it can be a life-saving scenario. So it's an amazing point. It's good for shock. I mean, if we had a patient under anesthesia that arrested, maybe the heart stopped, the pet stopped breathing, the heart stopped beating, then in conventional medicine, what do? We start applying CPR, positive ventilation, and then we do intracardiac epinephrine to see if we can get the heart beating again. I'm sure you've seen that on TV before, but it's the same thing that we do in pets. So the same thing, we're using intracardiac epinephrine to try to start the heart. All you have to do is activate that GB26. And so I remember after telling people in the clinic anytime we had a pet that arrested on, and this was a 9-doctor practice, and so we were in surgery all day long, and anesthetic people. We had 2 surgery tables, and we had 2 dental tables, and sometimes we'd have 3 or 4 patients under anesthesia at one time. And so if we ever had a pet that arrested on the table, that stopped breathing, literally died on the table, they would holler, "Dr. Thomas, come!" And I would go in there and I'd grab a needle and start pecking GB26. And every one of those pets would revive again. The heart would start beating, respiration would start again, and those pets would revive themselves. And another we use when we deliver puppies and kitties with cesarean section, and you get those puppies and kitties out, and they're not breathing. And they're not breathing because they don't go through the pelvic canal. They don't get that pressure that gives them that oomph to start that breathing. So a lot of times they come out and they're not breathing. We used to sling them around and stuff like this and breathe in their mouth and everything. All you have to do is put a little needle right there at GB26. They start breathing immediately, starts pinking up and everything. So it's a lifesaver. It's a lifesaver. So learn GB26 for yourself, for your friends, for anybody. You might save a life. Okay. So, general pain, and I'm talking just general speaking. Obviously, we want to do general pain points, and then pain points that are points that are associated with the region. So if we have a dog or a cat that's got pain associated with the hip, then we want to do general pain points, but we also want to do local points that move energy along that meridian. So, and remember, pain is the definition of pain in Chinese medicine we call stuck qi. It's the qi is not moving, and that's what causes the pain. So we want to get energy moving along that meridian that's affected that. So if we're working with let's say the hip, then we've got 2 meridians that come across that hip. So we've got the bladder meridian that comes off, and so we're going to hit bladder points that are local. And we've also got gallbladder points. So we're doing gallbladder 29, gallbladder 30. And so we're doing local points, but at the same time, we want to do points that are general pain points as well. And so those general pain points are bladder 60. That's real easy points in the back leg down by the ankle. Real easy point to find right there in that right in front of the Achilles tendon. So that's where bladder 60 is. And real easy to activate. That's a really nice general pain point. Some people call it the aspirin point. So it's just like taking a pill to relieve pain. So bladder 60, gallbladder 34. That point's really, really close. That's another point, can be a little hard to find. It's down pretty close to stomach 36. So it's on the outside of the leg, below the knee. And the way to find that point is you find the head of the fibula, and you can feel down there by your knee, come back kneecap, and you'll feel the head of that bone right there. You'll feel that little point. It's a knob coming up. That's the head of your fibula, okay? And so if you find that little head of the fibula, and then you move towards your ankle and it drops off, you'll feel that drop off, and right where it drops off, that's where gallbladder 34 is, right in that little indentation, right below the head of the fibula. And that's a really powerful point for pain, because that gallbladder 34 is all about moving qi, all about moving energy. So a lot of times, if we've got, let's say, some stomach qi obstruction and we're not moving, then we want to move energy, and so we'll throw in gallbladder 34. So if energy's stuck or it's moving the wrong way or not moving the way it's supposed to, then throw in gallbladder 34. It's not only good for pain, but it is good for pain, but the reason it is it's all about moving energy. So it's really good. Do it on both sides. So it's, again, once you find that head of the fibula, you've got it. All right. So bladder 60, gallbladder 34, liver 3 is a nice pain point. That's one of the master points. So learn how to find liver 3. It's on the back leg, on the surface of the foot, the paw. And so real easy to find and very powerful, very important point. Again, one of the 4 strongest points in the body. And then the last one is large intestine 4. We talked about that. Really good for pain associated with the head, like if you have a headache. Large intestine 4 is really good. It's a master point for the head and the face. And so any pain that's associated with that, it works particularly well. It's a good general point, but it really works well for the head and the face. And so with dental pain, if you have a pet that's had a dental procedure done, then work on large intestine 4. I mean, it's really going to relieve that. As a matter of fact, dentists that know Chinese, and some dentists know Chinese medicine, what they'll do is that they'll put a needle in a large intestine 4, and then they'll put a needle at lung 7, I believe, large intestine 4 and lung 7, and then they'll hook up electrostimulation, and they'll run that electrical stimulation and activate those 2 points for about 15 to 20 minutes. And once they do that, it deadens the mouth, and they can go in and do root canals. They can pull a tooth. They can do fillings, the whole 9 yards, and without having to use any lidocaine or anything. So it literally will deaden the mouth just using those 2 points and activating those points to the point that you fatigue those points, and it causes deadness of that. So it works really well when it comes to pain. So again, that stuck chi always has the liver associated with it. So bladder 60, gallbladder 34, liver 3, and large intestine 4. So that is it for the ones that I have. So you got any questions? Somebody typed in there, some Chinese guy, cough, cough, cough. I don't have a clue what that is. So I don't know how this person got in. Constipation points, Deborah, that's a good question. So Deborah asked, what would you please also cover constipation point? Absolutely, the number one point for constipation, 100% is stomach 36. Remember what I told you? A lot of points are regulation points. So stomach 36 is a master point of the what they call the caudal abdomen, which the large intestine is associated with that. So stomach 36 is your go-to for constipation, 100%. So if that won't do it, nothing will. In cats, a lot of times we get obstipated cats to where they've been constipated so long then they can't have a bowel movement. And sometimes we literally have to sedate those cats and go in there, irrigate the bowel, and mechanically break the fecal material down. And so I've had those cats under anesthesia, and to clean them out completely because their obstipation has been so long, and their poop is hard as rocks. I mean, like constipation, like concrete sometimes. And so once I get it cleaned out, you've got this big old large intestine that's overdilated. It's flaccid. It's like a balloon that's flaccid, has no tone. And if you listen to it on the stethoscope, there's no movement whatsoever. It's just there's no peristalsis, no bowel motility at all. Put a needle or activate stomach 36, hold your stethoscope on that abdomen right there, activate that stomach 36. Within just a few seconds, you're going to start hearing the bowel motility. That's going to start contracting, going to start moving. So stomach 36, it's a regulator, so you can use it for diarrhea. You can use it for constipation. It's all about getting the gut to function normally again. So constipation, stomach 36. There's other points that will help, but if that point won't work, nothing's going to work. Okay. So Glinda says, what about licking? Licking is itching. Okay. So if they're now, most of the time licking is about itching. Licking can be associated with pain, because if there's a pain area and they're trying to soothe that point, then again, that licking would be, you'd have two components. You'd have a pain component that you'd have to deal with. And a lot of time, if it's been going long enough, then there can be a shin component too. Obsessive compulsive licking, then that can be a shin. So you'd want to, in other words, a lot of pets, when they do that compulsive licking and they get those lick sores, then you want to do pericardium 6, heart 7, along with the skin points and what have you, the itching points associated with skin. Okay, so think about licking as itching. So you always want to do the itching points, and then try to figure out what's causing that. And if it's pain, then you want to do pain points. If it's a compulsive behavior because the dog's nervous or the cat or whatever, then you'd want to do shin points as well. I did a phone consult with a lady this week that her cat's got an autoimmune disease where it licks itself on the abdomen and inside the medial thighs. It's called eosinophilic granuloma complex. And so activating points for licking are for itching, and also activating points for the immune regulation as well. Okay. So Robin says laryngeal spasms. That's a good question. So are you talking about like reverse sneezing? Is that what you're talking about? Or because that's the only thing that I can think about. Because laryngeal spasm could obviously be, if that was caused by a bee sting or something like that, allergic reaction, then that could be a life-threatening situation. But most laryngeal spasms happen like epiglottal spasms with reverse sneezing. So could you give me an example what you're talking about, laryngeal spasms? Robin says, not sure he does this when he drinks water. Okay, it's not a cough. Because remember, if you have a laryngeal spasm, then it's going to sometimes interfere with the breathing apparatus. Okay, so sometimes they can have difficult breathing. So, is it coughing? Is it difficult breathing? Again, if I had a laryngeal spasm going on, then I would be treating local points right under the throat. Okay. No sounds like he's trying to get his breath. If he's really panicking, then I would probably do GB26 because it's a auto regulation point. It's a point that, so again, local points right here. These are points that I would work right here underneath the trachea, right there. I would work on those points. But it only happens when he's drinking water. A lot of pets, when they drink cold water, will get coughing or a reaction to the back of the throat. So what might help you find out what's the underlying cause with that? See if cold versus not cold makes a difference. In other words, offer him some cold water, it's really cold out of the faucet or what have you, and see if it's worse than if it maybe warmed it up a little bit. See if the temperature of the water makes a difference. Because if the cold water makes a difference, then that's something that we commonly see, and we can work on establishing balance, because that's a symptom associated with a upper respiratory scenario that's been going on. Okay. So see if you can find that out, and then shoot me an email or post it on the Facebook site, and we'll dig a little bit deeper and figure that out. Okay. But first thing that I think about, if you're struggling to get a breath, do GB26. If not, then just, essential oils, whatever you like best for that, then hit those points right underneath there. But let me know how that works. Okay. Let's see. Glenda says legs, ankles. In regards to what pain are you talking about? Remember, legs, that's the whole leg, and that's way too much to talk about pain. There's generally not pain in the leg. There's generally pain somewhere in the leg, and so we want to isolate it. So is it in the hip? Is it in the knee? Is it in the ankles? If it's in the ankles, then you want to do local points. Okay, so local points would be like bladder 60 would be a perfect point for that, because it's right next to the ankle, and it's a general pain point as well. So for ankle problems, you like to go above and below. So you said he licks them at the joints. So a lot of times where they're licking can be a point that you can activate. All right. So if there's ankle pain and you know it's ankle, and how do you know? You just do a little slight manipulation, flexion and extension. And if they react to that, then you know that's what's causing it. But if I had a pet that I knew had ankle pain, I would be activating bladders. Remember, we do general points, the general pain points. So I'm going to do bladder 60 and liver 3. Okay, for sure, because that's on the back legs. All right. but I'm also, the local points I'm going to use bladder 60 because it's right next to that. And then I'm going to use kidney 3, which is on the inside at the same level. So if let's say here's the leg right here and here's the ankle down here, and then right above the ankle on the outside of the knee is bladder 60, and at the same level on the inside of the knee is kidney 3. And the only thing that separates them is Achilles tendon. So just inside the Achilles tendon, you have bladder 60 on this side and kidney 3 on that side. So I'm certainly going to do those points right there. And then I'm doing liver 3, which is on the other side of the ankle. And so we're going to be moving energy through that as well, you see. So local points, just find local points to look it up. But I would certainly do those points. I do bladder 60, kidney 3, and then also liver 3 for sure. Okay. Yeah, for sure. So anybody else? Great, he's a jumper. Okay. So anybody else, Deborah? Jonah, would you use the same points for both over and under active immune regulators? Yes, of course. Immune regulators, it's all about putting it back in the balance. Okay. Just think of auto regulators as putting them back in the balance. And whether it's the immune system or like stomach 36, just like I said, you can use it for diarrhea, use it for constipation, because you've got both sides of the extreme, and that immunoregulator is going to move it back in the balance. That's one of the reasons I like using pumpkin. Pumpkin acts as a regulator. And so you can use it for diarrhea, you can use it for constipation. So these points will do the same thing, yes. So the immune modulators or immune regulating points works for either side, whether it's an overactive immune system or an underactive immune system, okay? Anne says, would you activate all the points for a symptom or just one? Depends on how bad it is, to me, once you learn to find these points, then they're real easy, and why not? You get your activator, you have a little bottle of whatever you're going to use as your activator, or a tube of something if you're using arnica, put a little bit on your deal. It's not going to take you 5 minutes to do the points. Why not? Yeah. Okay. And remember, do both sides. If there's only 2 acupuncture or meridians that only have one, so all the rest of them are paired. So do it on both sides. Do it on both sides. It's funny. Let me give you an example. I remember when I was in school learning Chinese medicine, we had a large animal veterinarian that practiced up in Minnesota, I think, or Wisconsin. And he had been doing Chinese medicine for a lot of years, and he worked on cows, okay? And he did a lot of Chinese medicine on cows. And he was talking about a cow that had been down, and I think it had a broken leg, if I'm not mistaken. And so anyway, the leg that was broken was too painful for him to work on. Now, he was using needles. And so he used the points on the other side, okay? And so that's a really good thing to remember, is that if you have a point, let's say that there's a spot that's so painful that, well, you're probably not going to have a problem because you're using an activator. But if you'll get the same benefits by treating the other leg. The points on the other leg will do the same benefits as doing that on the affected leg. As a matter of fact, there's a guy that is a human Chinese veterinarian out in San Diego, and I think I've heard that he just passed. But he came up with a method of treating the contralateral joint. So, and I started doing this a lot with like cruciate injuries and stuff like that. And so let's say you had a pain associated with a cruciate injury in the right knee. Okay, so what he would do is not only would he treat the right knee, but he would treat the contralateral joint. So what he would do is he would treat the left elbow. All right. So it's a balancing thing. It's a crisscross balancing thing. So the right knee in the front leg is equivalent to the left elbow. Okay. So he would treat the elbow pain and he would find the point. Now remember, he's working on humans. He would find the pain that would be sensitive in the elbow, and he would treat that pain to cause the relieving pain in that right knee. And he got excellent results with that. So anyway, okay, is it okay to activate points for prevention? Yeah, I would say. Now, maybe you might want to give me an example, because I wrote a blog. I was talking to a lady this week that on a phone consult, and I want to reiterate this. And if you haven't read this blog, then you might want to go to my website and pull it up. I don't remember what the title of it is, but this is something really good, and I think I've talked about this before. In here in the United States, we define our health into two categories. And we define it by whether we're sick. And I'm just going to talk about us. You can talk about our pet. So if you're ill, then we consider you being sick. All right. And then if you're not sick, then we consider that being well. So basically we have two criteria for our health: sick and well. Okay. But that's not what it is. That's just what we define using our external senses. If we're sick, we're sick. And if we're not showing symptoms of illness, then we're well. But that's not how it works at all. If you went out and looked at every person and every pet out there in this country, you would find very, very few of them that were really well. Okay. So imagine that this point right here is you're in perfect balance and you are really genuinely well. Okay. Perfect health and well-being. And then over here, you're sick. And I don't care if it's kidney disease, I don't care if it's epilepsy, I don't care if it's IBD, you've got an illness here. Okay. You've got this area from here all the way over here. So this big gap in between, this gray area, is where most individuals are. They're not showing signs of illness, but they're not well. They're in between. All right. The problem is that in conventional medicine, we can't identify those gray areas because the symptoms haven't showed up. In Chinese medicine, a lot of times we can, by doing assessments from a Chinese medicine perspective, picking up energetic points that are active already. Because what they do, the energy's changed, but it hasn't created its problem in the physical body yet. And so it's a good way to ascertain early imbalances. And that's where most of the individuals work, right there. And so they're in this, they just haven't gotten to the point yet that they've become clinically ill. And they are a long way from being well. And so that's where most of them are. So that's why I mentioned that to you, Jonah, is because if we're not really preventing this, we're treating that gray area. And yes, we might be preventing it from becoming an illness. Yes. And so in that definition, we are preventing. But we are working with imbalances. Like whenever I have a patient that comes into my office and let's say they brought it in because it had a torn cruciate ligament. Okay. And so they come in for me to deal with that. And I'm not just going to be working on that ligament, but believe me, I see this a lot of times, and it really is bothersome to me that a lot of people take their pets in and for, again, I'll use the cruciate. They go in there and the vet works on the local points for the cruciate and doesn't evaluate the overall pet. But let's say I'm working on this pet that comes in, and then I do a Chinese medicine exam, and maybe I'm checking the Ashi points along the back, which are bladder points, and maybe I'm moving along there, and the dog reacts, or I sense that bladder 18 is out of balance, and I go, oh, he's got an active Ashi point at bladder 18, and so what does that tell me? It tells me that his liver is out of balance. Well, he doesn't have any signs of liver disease, but energetically, his liver is out of balance. So I'm going to treat that point because I don't want to wait until the dog gets liver disease. So maybe I go down and I hit a bladder 20, and I go, oh, bladder 20 is a spleen point. Well, his spleen's out of balance. So yes, in that way, I'm preventing the illness from manifesting itself, but it has already shown up as an energetic illness. Okay. And so I'm going to be doing that. And so it may not have anything to do with the torn cruciate ligament, but it's certainly an energetic imbalance that is not normal. It's showing me that it's not normal. And so I'm treating that to prevent that from becoming an illness. But at the same time, I'm doing it because it has shown me that there is, it's moved away from wellness. Okay. All right. Jonah says, to activate, do you just put a dab of arnica on the spot, or do you apply a bit of pressure? GB Twice, you don't have to put pressure. No, you just, all you have to do is put it on the skin. As a matter of fact, they say you don't even have to get it at skin. You just get it on the hair, because remember, it's the energy of that activator that's going to activate the energy of the point. All right. So just, you have to get it near it. Just, that's all you have to do. So you don't have to rub it in. Just put it on there. And then she said, example, been told the pet is heading towards kidney disease. Okay, heading towards kidney disease. So how do we know that the pet's heading towards kidney disease? In conventional medicine, the first thing that we, there's two ways to determine kidney disease in conventional medicine, and that's urinalysis and blood work. And most veterinarians, and we talked about this many times, are very slow to work to get urinalysis. So they rely on blood work. And unfortunately, by the time the blood work shows up that there's a kidney problem, then the pet is only working about on 20 to 25% functional kidney. So before it even changes, like a creatinine, before the creatinine moves, 75 to 80% of the kidney has to be diseased. So that's a very poor way to determine that your pet's got kidney disease. And usually by then they're very sick. All right. So and maybe if they do a urinalysis and they pick up the fact that the urine specific gravity is dilute, and they take it legitimate, maybe that can be an early indicator before the pet's sick. But there's already physical changes that have occurred in the physical kidney at that time. So we've already got kidney disease. And so early kidney disease, from a conventional standpoint, means that the organ itself, the form of the organ, is already diseased. To me, prevention, remember, everything is energy, and the energetic reflection into the physical, it moves from the energy into form. Okay, so if we pick up the imbalance in the energy before form is involved, then we keep that form healthy. Okay. So that's the best way to prevent it, is to prevent it at the level of the energetic body. So, John, if you're saying that the vet told you that your pet's heading towards kidney disease, I'm hoping that person was using some modality in energy and was saying, okay, I'm picking up indications that the energy, there's energetic imbalance going on with the kidney. And so what I can do is I can restore balance to that energetic component so that it reflects itself in a healthy kidney instead of a disease. That's the best prevention. And people that do conventional or practice Chinese medicine, then what they do is they will get, they told us in school, don't wait until your pets are sick. Get them in every quarter. Get them in the healthy ones, get them in every quarter and do a good assessment of them. So you're picking up energetic imbalances before they become disease, and you maintain that balance. You get them back in the balance. So what you're doing is, and if people would do this and go to a really good practitioner, you know how a lot of people will go in for their annual workup. So they take especially in these senior pets, they go in there and they have this annual senior exam. And what does the vet do? Listens to the heart, palpates the abdomen, looks at the eyes, does a 5-minute cursory examination on the pet, asks you a few questions, and then takes some blood. And that's generally what the senior component is. And then when you look at that, it's pretty doggone superficial. And in the blood work, just like I said, is not generally, it's very superficial. But if you took that same senior pet and you went to a really good Chinese medicine, now this is, again, a pet that is acting normal, and the reason you're taking in there is because you want to get some blood work done and you want to see if it's doing fine. Okay. And like I said, when they do the examination, they do the blood work, call you and say it's fine, then you're feeling really good because you're thinking that your pet's well over here, but it's not. It's in this gray area. The best way, if you did it, would be to go to a really good Chinese practitioner that really did a good, thorough energetic exam to find those energetic imbalance points, and worked on restoring balance. That would give you more bang for your buck than this superficial thing. And believe me, I spent many years doing these senior exams, taking blood and urine out of pets and doing a cursory exam. Nothing would aggravate you more than to do a good, thorough, what we call thorough senior exam and chart. Bills, I don't know, it's probably $200 or $300 now. And then the pet goes home, and then a week later they call you up, and the pet comes in and it's vomiting and ends up having a tumor in its stomach. And they say, well, we just had a senior exam done 2 weeks ago. Why didn't you pick it up there? Because those scenarios don't show up on blood work, and you can't feel the stomach because it's behind the rib cage. So we missed it because it's so superficial. It has the potential for missing so many things. But if that pet would have gone and had a really good examination done by a good Chinese practitioner, then those points associated with the stomach would have been active. And then that he or she would have known we had a problem going on in the stomach. You see? Now, whether you chose to treat it like that or maybe go in and have films done or an ultrasound or whatever, but it would have been a flag that there's a problem there that would have not been picked up from a conventional standpoint. You see? So it's unfortunate that we don't do that, because that would be really good way to be a preventative, just like you said, Johnny, is a preventative would be to be doing it from a Chinese medicine perspective. But most people, when they finally call a Chinese practitioner, it's because they've been working with all these conventional people, and they've come to a dead end, and it's not working. So instead of being the first person that we call, the Chinese practitioner, it's generally the last person that we call, and that's unfortunate. So, because it does work so well as a preventative. Yeah, it's very proactive. I probably told this story to you before. In China, they have a doctor for the province, and they're probably going crazy over there with this coronavirus. But the point is, it's all based on proactive preventative stuff. So when they have like this epidemic going on with corona or another problem, then the government calls the doctor and say, hey, why did this happen? You're in charge of keeping them healthy and preventing disease, and not being reactive and waiting until they get sick and then treat them. Okay. So Ann says, I thought I would take Wilkie in to check him out, and they want to do a kidney panel. Should I not do that? No, I'm not saying don't do that. But kidney panel, that what they're saying is do blood work to look at the kidney function, and basically you're looking the three primary, or BUN, the urea, nitrogen, creatinine, and phosphorus, and then they do an SMDA also. But the point is, they're using blood work to determine if the kidneys are having a problem. But remember that blood work, if that's what they're talking about in the kidney panel, meaning blood work, then the blood work is not going to change until the kidney is seriously diseased. Okay. Remember, again, statistics says 75 to 80% of the kidney has to be damaged before the blood work will start to move, okay? And if they are looking at kidney, then you make sure that they do a urinalysis, because nothing will get me aggravated faster than somebody that contacts me for a consult and their pet's being treated for kidney failure or chronic kidney disease, and they haven't had a urinalysis done. To me, there's no excuse for that. Absolutely none. Okay. He isn't eating like he should. And, there was a question I remember when I was taking my boards to get my license to practice veterinary medicine. And one of the questions said, give 12 or 15 conditions that can cause a cat not to eat. And that was probably the easiest question on the exam, because so many problems will cause a cat to not feel good. And when they don't feel good, they don't want to eat. So yes, kidney disease can cause a cat not to want to eat, pancreatic disease, gut disease, liver disease, on and on and on. So I can list a whole lot of diseases that can cause a cat not to want to eat. It's just too vague of a clinical symptom. So, and from a conventional standpoint, yes, they're going to do. So if I was just practicing conventional medicine and I have a cat that comes in that's not been eating, and And then what I'm going to do, I'm going to do a good physical examination on it. And if I don't find an answer to why, in other words, if I reach down there and I feel this big tumor in its abdomen, then I'm going, oh, we got this big tumor in this big mass, and that's obviously where the source of our problem is. So maybe we're going to take an X-ray, we're going to do an ultrasound and see what it is. But the point is, if you do a physical examination and you don't find anything that you can sit there and say, well, this could be the cause, then the next step is they're going to take some blood. All right. That's just following the conventional algorithm. But what I'm saying is we want to be thorough from a conventional standpoint, especially if we're thinking kidney, we don't want to just do blood. We want to certainly do urine as well. Okay. So make sure that they get a urine sample. And the other thing too, because you're new, you haven't been on a lot of our live discussions, but remember, if you're going to get blood, remember guys, I'm going to test you real quick. See if you remember this. Remember, we did a live presentation on laboratory work. And remember, anytime you're going to have blood, what do? We make sure we fast. So we do an overnight fast and get the appointment scheduled in the morning. So we don't want to feed our pets before we get blood, because that's going to alter the effects. And I've seen too many veterinary hospitals that would allow them to take blood out of a non-fasted sample. Pet. To me, it's a waste of your money. It gives you abnormal results that are caused by the lipids in the serum, the sugar in the serum, and what have you. So it gives you false results. And a lot of people, they, instead of sending them home, tell them to get fast, they go ahead and say, hey, I'll just get it and we'll take a look at it and see if anything just jumps out. Again, so this is what this is the whole purpose of this Facebook group, is to empower ourselves to not allow veterinary clinics to do things like that and make mistakes that affect our pet's health. So we want to do a fast. Now Anne's cat, if it's not eating, then obviously more than likely it will self-fast because it's not eating. But the point is, you don't want to feed your pet that morning that you're going to get blood work. You want to make sure that it's a fasted sample, and usually an overnight fast is all you need. So don't forget that. So Anne says, I asked about practitioners in Spokane, and you said that there are some who do acupuncture. Can they do energetic analysis? Yes. Remember, Chinese medicine is an energetic modality. So anybody that's veterinarian that's doing acupuncture is practicing energy medicine, okay? So we're activating points, and those points are energetic points. So yes, the lady that I like, that's been doing as long as I have, that's here in Spokane, is Rosemary Astorino. And she does so she does a good job. She is not really a holistic vet, so she's not going to deal with diet. She's not going to deal with a lot of these other things, but she is going to do Chinese medicine, and she's going to do a good assessment and from that energy perspective that I was just talking about, checking Ashi points and stuff like that. But again, I wouldn't discourage you from going and getting the blood work done, because it may not have anything to do with the kidneys. It may show up, it may have elevated liver enzymes and what have you. And then if you have that and whatever they recommend, then again, you can, whoever's doing the Chinese medicine, I mean, you can contact me and let me know what they are, and then I can tell you what points you can activate. So, I mean, so we want to use all these. That's what I was saying in the beginning. You want to use this as an adjunct because you know it's going to benefit, okay? And says, do you think that would be better than to do first than the other vet? Sure. Go to the regular vet. I send people I had a lady that contacted me today that wanted to do a phone consult. And I said, what I want you to do is go to your regular vet and have them do this. And then when you get the results, contact me and we'll schedule the phone consultation, because I wanted to find out something that they were going to be able to check for me. So yeah, go ahead and keep your appointment. Make sure that it's a fasted sample, get the blood results. And if it is kidney, make sure they do a urinalysis, and then let me know what they find. Shoot me an email, let me know what they find, and we'll go from there. Okay. And then if I think that Rosemary or somebody else will help you, then I'll point you in that direction. But do that first, and then email me to let me know, or post it on here. We can all learn. But I'll be happy to take a look and see what's going on. Okay. Remember, I sat on that side of the desk for many years. And so anyway, So, okay, guys, boy, I've kept you here for twice as long as I. So I hope you. Looks like most of you are still around, so I appreciate that. Any other questions? And then before we sign off, I really appreciate all you guys joining in. Makes it a lot more fun, question and answers. But if you think of later, just put it on the Facebook site, and I'll be happy to answer. And then we'll go from there. All right. Hope this has helped you. Keep it as a reference. So, and I know it'll help you not only now, but down the road. Okay, guys, thanks again. Namaste. Have a beautiful evening, and we'll talk soon. Okay, bye.